All right. Hey, ladies, how's it going? Now that we got the computer's brain fog to clear up. All right. Welcome to Wellness Wednesday tonight. It's nice to be with you all again. I'm going to just make sure. Um, Looks like things are connected just fine. We had some issues connecting with Zoom again. I'll tell you what. When it comes to technology, it's a real love-hate relationship. So I'm glad we got connected, and I'm glad to be with you tonight for this Wellness Wednesday. Uh, for all you new ladies, I'm Dr. Redd, and I announced also the upcoming masterclass. I'm super excited about that. Again, that gets started on February 17th, goes through the 21st. The times, well, we always start at 6 p.m. Pacific, 7 Mountain, 8 Central, 9 Eastern. I'm sorry for you that it's so late for you Eastern Coast ladies, East Coast ladies. It's it's gosh, when we're able to share this with everybody around the country, we've just got to pick the right time for everybody, and that's what we've got. And I'm going to be sharing, gosh, some such important information during this masterclass. I'm going to be sharing why you still have thyroid symptoms despite having normal test results, right? Why I'm going to talk about why thyroid diets are not helpful, okay, and what to do instead. I'm going to show you how to move beyond the normal thyroid lab markers with actionable steps so you never fail again, right? I'm going to talk about why most thyroid supplements don't really help, but also how to determine which ones actually can work for you, and it's all about the process. The information I share in the masterclass has helped to change the health and the lives of so many patients. I will share the blueprint that has helped thousands of women just like you to find their causes and reverse their symptoms of their thyroid issues. All right. Tonight's topic is so important. And before I get into, I better say my disclaimer. Anything that I say tonight is just health information and is not health advice. Don't stop taking, or change the way you're taking any of your medications. And if you feel like you really should change, please first consult with your prescribing practitioner so that they can help you make those changes safely. And by attending this Wellness Wednesday tonight, this does not establish a doctor-patient relationship. All right, so this is a super important topic tonight. Many of you are dealing with this every day. I'm telling you, every day I'm talking with potential patients who have and are dealing with brain fog. Yeah. And this symptom, man, it can have so many causes. And it's so important to get the root causes, get to the root of why you're having this brain fog to be able to fix it. So what is it? What is brain fog? Almost everyone describes it differently. Okay. I'm just going to list things and then I'm going to go into things a little in more detail. Okay. Trouble with focus, memory, forgetfulness, word finding, unorganized or being disorganized. People describe it as, having dull headaches, getting lost in conversation, not following very well in conversation, just being disoriented. Oh, you have to write everything down. Being tired or sleepy. Some people just think that's brain fog. That's how they describe it. Feeling dizzy or lightheaded too. Maybe having an actual pressure sensation. Maybe it's just moodiness or depression. Some just even have any trouble describing it at all. So these are a lot of ways that people describe it. And it's no wonder doctors can look at you a little funny when you say, hey, doc, why do I have brain fog? Because it's not it's not super well defined, and it's definitely not a medical term, right? It's definitely not something that I learned to think about or speak about super intelligently during medical school. So Um, it's interesting because this affects us so much and in so many different ways. And I dealt with this personally. I was, dealing with this when I was going through my issues, and I share more about this during the master class as well. I spoke with a patient today who lost her job because she was just making too many mistakes, and this was completely unlike her. This is not who she was. Um, she's not usually a disorganized, person who doesn't complete her tasks and makes mistakes with, different. And she was working as a scheduler, and so there were mistakes she was making with that. And my goodness, brain fog is an important symptom to pay attention to and to define properly for you, because it can have so many causes. So many things cause brain fog. Uh, One of the most important things is insulin resistance. All right. And I'll talk about these a little bit more. Insulin resistance, hypothyroidism. This absolutely relates when you have hypothyroidism. Adrenal dysfunction, liver disease can lead to brain fog and other cognitive issues. Um, Kidney and bladder issues, UTIs, can actually contribute to brain fog. Autoimmunity definitely can contribute to brain fog. Brain fog is an early sign of Alzheimer's and cognitive decline, which is now, Alzheimer's is actually now a leading cause of death in this country. Okay, some of these early signs, these early signs of Alzheimer's and cognitive decline that we term brain fog. Okay, so like memory lapses, let's talk a little bit about that. So many of you may relate to these. You walk into a room and forget why you did that, and for most of us, it just takes walking back out and walking back in, and generally, oh yeah, now I know. It's like cross the threshold and somehow, again, and somehow magically you remember, right? Coming, then remembering like where you put things, misplacing belongings, especially phones. I had a patient tell me that, and she's with, I'm talking about her test results with her husband, and she was telling me, yeah, he was asking, if he'd seen, his phone, or if she'd seen his phone, and she was telling him that, well, she couldn't even find her phone, and yet she was actually holding his phone in her hand. I mean, if that's not brain fog, I don't know what is. Then trouble finding words in conversation, maybe in writing things up, and you're not coming up with the right words like you used to be able to. Maybe you're writing everything down because you just have trouble remembering things. And we kind of shrug off these symptoms like they're really, I don't know, like they don't mean a whole lot, like they're really nothing. Certainly they're kind of embarrassing if you feel like other people notice that they're happening. But these are symptoms that are very important and are not normal, right? I mean, we've all, well, I shouldn't say all, many of us have gone to the doctor and have told our doctors about these things, or you may have, I haven't, but where they tell you, well, it's just your age, right? And that's pretty much the catch-all. It's about your age. You're getting older. You're going to forget things here and there when you get old. No, ladies, this is not a normal symptom with aging. I'm telling you, there are reasons why. What does happen with aging is when imbalances go on longer as you move through life and age more, then yes, things can get worse. But this is not aging. We all know people who are older than we are, who have no trouble with memory. They're sharp as a tack. If this were true, everyone with these symptoms, everyone at a certain age would, have these symptoms of brain fog. These symptoms have to we have to pay attention to them. When something is going on like this, we know then that the body's trying to tell us that something is imbalanced, something is not right. Now, okay, so when you might get changes in moods, right? Well, what about when you have hormone imbalances? Couldn't this also be a cause? Or, but mood swings, mood issues, there is some overlap, certainly. So is it thyroid? Is it insulin resistance? Is it hormones? There are many different things that can cause these. Irritability can come, can be, people can describe their brain fog as irritability. And so there's a lot of overlap with this symptom and with these mood changes. All right, and this can also be an issue in developing Alzheimer's disease. All right, because these are, like I said, when you start to have mood swings and irritability, this is one of the major things that includes, that Alzheimer's includes. Okay, being socially withdrawn. Now, this can overlap again with so many things. Is it depression? Is it just low energy? Do you have less desire or ability to interact socially, like in conversation, or in, just maybe you were used to speaking in public, and now there's no way in heck that you would get up in front of a group and speak to a group. So, and so do you organize your thoughts as well as you used to? I mean, there's so many reasons why you may not interact socially as much. Again, getting lost in conversation can be really, that's been something that I have had issues with in the past, and it's not a fun place to be. It kind of degrades your confidence, right? That's why a lot of you don't feel like going out socially. So this brain fog, it's so important to find out why this is happening. So yeah, maybe you just aren't able to follow in conversation, and some of you may even have difficulty following what I'm talking about tonight. So it's a symptom that must not be overlooked, and it must be evaluated properly. Now, maybe disorganization is how you might describe brain fog, where you're maybe slower at completing familiar tasks. It's getting harder to complete familiar tasks. This reminds me of one of my patients in the past. And all I can remember is his last name, Smith. So of course I won't tell you his first name because I don't recall it. And I don't think it's because of brain fog. It's just I've had so many patients. I just remember that he came to me with difficulty with his memory. He was a programmer, and he ate, breathed, drank, slept programming. I mean, his whole life was programming computers, and he was so disappointed when he was finding it difficult to program because of brain fog and what we determined was early Alzheimer's for him. And as we went through his process, and I'm not going to get into this in a lot of detail, but we did the right testing with him, got comprehensive testing, found out what his root causes were, helped him treat those root causes with the model of care that I have developed. And he started programming again, and he was elated. I mean, the first time he, he told me that he'd gone back to programming, he was like a kid in a candy shop, or just giddy with glee. I mean, he was so excited about being able to program again, and he wanted to tell me all about this albeit kind of a smaller program that he had completed, and wanted to explain to me how it all worked. And it was so fun to see this, the reversal of these symptoms of early Alzheimer's, and this brain fog that he was in. Okay. And so yeah, this disorganization, trouble doing completing tasks. Trouble making decisions can also be part of brain fog as well. I also want to mention that there are 6 different domains of cognition that we focus on, that we want to maybe be a little more cognizant about. When we want to discuss cognitive function, we talk about attention. So that's the first one. Brain speed is the second. Memory, people skills, intelligence is the fifth, and navigation is the sixth. So being able to get around, right? What would we do without Siri or Google Maps, or these phones we have that help us get everywhere? I know many of us would be lost without them. I get it, but we really need to kind of work on these domains, and some of us need to exercise these domains a lot more than we do without helps, right? So when you're having trouble paying attention, when you're having trouble focusing, you will have trouble recalling things like you used to be able to. Say recalling a phone number someone tells you, or anything really that you're conversing about, or maybe reading. Maybe you're having to reread a paragraph or a page because you simply can't focus on what you're reading, and have to go back and reread it. And so I think a lot of us make the excuse that, well, I've had trouble focusing my whole life. Does that mean this is normal? I mean, does that mean you haven't been dealing with brain fog since you were young? No, it's absolutely a symptom, and it's definitely not anything that's normal. Okay, so what about disorientation? Like having trouble remembering where you are, why you're there in some place that you're in. Maybe during, you're having trouble driving once familiar routes, right? You're having trouble remembering where to turn. So when you're having, and some of these are fleeting. Sometimes this is just really fleeting, and it's certainly unnerving. It would be for me if that happened. Some people, like I said, describe brain fog as lacking energy. Okay, so, and many describe this as just a mental energy. I actually had one patient describe her brain fog as kind of an eye strain issue, kind of an eye fatigue issue, and that was an interesting way to me. I hadn't really heard that before, and so this eye strain issue, or mental strain, mental fatigue kind of thing, where maybe you didn't used to be like that. Maybe you had no trouble just engaging with someone or something without any issues, and now it's like you have to work really hard to focus on that one thing, to focus on that conversation, or reading that book or that article, and having to reread the paragraphs. Say it's part of your work, and you're trying to assess something based on something you have to read, and it just gets harder and harder to accomplish that. So this is brain fog, right? Lightheaded and dizziness, right? Is the way some people describe it. And This is a common symptom of adrenal dysfunction too, not just low thyroid or insulin resistance, but um, when you have adrenal dysfunction and you have electrolyte imbalances, and this is shown in your tests, in the comprehensive testing, I can, you know, uh, during the master class, I will go over a lot of these tests and show you what I mean. But um, this is a common symptom. So if you're dealing with brain fog and trouble focusing and lightheaded and dizziness, which is again kind of a very often a disconcerting kind of a symptom. It can be really bad for some people. It can be accompanied by heart racing, and so you feel like you're having anxiety or a panic attack, or worse, a heart attack. Um, and when in fact this is an adrenal issue, and it definitely can lead to it can cause brain fog. And during the master class, I discuss several case studies. This is a lot of fun. I go through the tests and all of these functions, all of the factors that help thyroid hormone to function in every single cell. Um, you know, like, do you women have enough estrogen or progesterone, and are these hormones balanced appropriately? Um, Men will need testosterone for the brain to be, to have better cognitive function. Have a patient um, who ended up needing testosterone supplementation, and that helped out his brain fog, his cognitive issues quite a bit. So it really, we have to look for these things in the test. Insulin resistance. So when blood sugar is too high, and the blood-brain barrier is breached because of other problems, leaky gut, causing leaky brain, and some of those triggers that cause that. Well, without this protection, glucose and insulin can get inside the brain and be very toxic and disruptive, inflammatory. You've probably heard of type 3 diabetes, also known as Alzheimer's disease, right? When we start getting this inflammation of the brain, then that starts breaking down the white matter, the connections in between your neurons, and start losing volume. That's what Alzheimer's is. It's a volume loss. So specifically white matter volume loss. And so this is the most common cause of that is insulin resistance. So I'm going to talk about toxins, all right? Toxic illness, biotoxin illness. So mold and Lyme, these are biotoxins. So biotoxicity will cause inflammation and this imbalance that can cause brain fog. Certainly, we look for chronic alcohol use or drug use. Even multiple exposures to general anesthesia can cause brain fog and neurodegeneration. So those of you who have had multiple surgeries requiring general anesthesia, studies are showing that this is a significant risk factor for developing brain fog and even Alzheimer's disease. Okay. All right. Heavy metals. We'll look for those. We talk about, cadmium, aluminum, lead, mercury. These are some of the most referenced metal toxins for affecting your brain health. And there are vascular issues that we'll see maybe some signs of in your testing. So we talked about those. Decreased blood flow to the brain, because now this might be news to you, but this can happen because of low B12 and folic acid, which when you lack these vitamins, these the active forms, this can cause your red blood cells to be too big. And I just spoke with a patient about that today. A simple measurement in your CBC right from your labs, right? The MCV is the one we're looking at. mean corpuscular volume, that is the volume of your red blood cells. And when your red blood cells are too big or the volume is too high, too much, those single blood cells cannot fit through those tiny capillaries at the extremity of your anatomy, we'll say, right? So like it won't fit through these tiny capillaries in your brain. And this is where you can see on MRIs a lack of volume of the brain, because your brain is not getting perfused. It's not getting oxygen to those outer reaches. And so, it's brain fog is often due to, this lack of nutrients, B12 and folic acid, for example. All right. Certainly strokes can affect your brain, and TIAs and, these mini strokes, right? So this is really important to have in your history, to know about, for me, if that's part of your history. All right. So you've got to have comprehensive testing, and someone who can go through that and give you a comprehensive diagnosis and figure out, your root causes. You will need someone to do this, and who can provide you the right coaching and, lead you through that process of digging deeper and finding the root causes, doing further testing and retesting and recustomization of care that is what is necessary to reverse this, to help you make the right lifestyle changes, to help you resolve this brain fog and certainly decrease your risk for developing Alzheimer's disease. So if you need help fixing this, that is where, you have to get comprehensive testing. So this is what I talk about extensively in the masterclass. I want to tell you about another success story. I'm going to talk to you about Angie, and she came to me at 76 years old. She was dealing with a lot of brain fog, a lot of memory issues. I'll talk a little bit more about that. She was a very educated woman, worked as a social worker, very well read, loved to read for, not just, work, but leisure as well. And because of her brain fog and her cognitive decline, and what we determined was early Alzheimer's, she was not reading anymore. She had stopped driving because of occasional disorientation, and this just scared her to death now to get out on the road. She was not confident anymore in her ability to get around. And she was losing words. She used to play bridge with a group of lady friends, and she stopped going because she was so embarrassed. She was embarrassed because her brain wasn't working very well. She wasn't coming up with the words she wanted. And she also had type 2 diabetes, and she had thyroid issues and Hashimoto's, and she had, her A1C was somewhere around 8.4, and she was on medications for all of this. When we were done with her care, I remember she was driving confidently. She was back to reading. She was definitely coming up with words better. She was so funny. She said, I went back to playing bridge with my friends because I can come up with words now faster than they can. And she could converse so much more fluidly. It was just fun to see her transform in this way. Okay. So it was just an awesome success story with her. And she successfully reversed her diabetes too, and got her thyroid under control, and many of the other issues that she was dealing with, and some of the other risk factors that we've talked about here, she was dealing with. And we treated those and took care of those, and she reversed this process of cognitive decline and the brain fog that she was dealing with. So ladies, I'm super excited about this upcoming masterclass. I'm going to share with you my thyroid repair blueprint and in its entirety. that has worked for thousands of women who struggle with this brain fog and other symptoms that are so frustrating for you and just that you deal with, a lot of you deal with. I'm going to share with you the quickest, the smartest, and healthiest way for you to fix your thyroid issues. I'm going to share with you how to move beyond the fallacies of believing that it's all in your head, that this is somehow related to age, or just accepting that this is your new normal. Okay. We need to get away from that because, if Angie, who is 76 years old, could reverse this, why can't you at 55 or 60 or 70 reverse this, right? These things, these symptoms. I'm going to share with you why you're still stuck despite trying everything and just so much more information that I can't wait to share with you. Can't wait to connect with all of you at the masterclass. So thanks for joining me tonight for Wellness Wednesday. My hope is that with this knowledge, you will feel empowered to affect real change in your health and in your lives. And I want you to have a great evening. Post your questions in the comments. Not going to take time to answer those right now. Got a lot to get done still, but I want you to remember to have hope. There are answers, and have a great evening. And remember that you still have the power to heal. All right, take care.